Welcome to the Wellness in Asheville podcast, where we shine a light on the people, practices, and places that make this city one of the most inspiring wellness communities in the country. I'm your host, Travis Richardson, founder of Be Well Asheville, your local news source for health, wellness, and community events. All right, I am so thrilled to have today's guest with me because this is someone who has been quietly doing some of the most interesting work in medicine right here in our backyard in Asheville. We are talking about a physician who left the insurance model behind, built something completely different, and is now helping people figure out exactly what their body actually needs, not what the latest wellness trend says you need. Dr. Troy Jackson is a family medicine physician with a special focus on precision medicine, improving health span and restoring health. He helps patients cut through the wellness noise, identify their true health needs, and create a personalized path to long-term vitality. His approach blends systems thinking, comprehensive lab analysis, and long-term clinical relationships. So without further ado, let's hear it from Dr. Troy Jackson. So today we've got Dr. Troy Jackson on the show. Welcome to the podcast, Troy.
Thank you, Travis. Thank you for having me. I'm excited to be here.
Yeah, we had a great introductory talk, and so really was impressed with your skill and your knowledge. I pretty much could throw anything at you, and it seemed like you had an answer. So I think we could probably do a 3-hour podcast, although we'll save the listener that. But think we could probably do a pretty long one. But for anybody just meeting you, give us the quick version. Who are you, and where are you practicing, and what is Authentic Health?
Yeah, so I am a family physician here in town. I've been at our clinic. It's called Authentic Health since 2019. The clinic, though, has been around since 2005, I believe. It used to be Vickery Family Medicine. The founder, who's still my colleague, is Dr. Gus Vickery. And we did primary care for a long time. And our interests that we went into medicine for just didn't feel like we were getting that in our day-to-day practice. We wanted to be healers. We wanted to help people improve their health, restore their health, prevent disease. And our day-to-day work just in the regular family medicine clinic just didn't feel like we were getting there. There's so much left on the table. And so there are a lot of different avenues. We eventually moved to an Authentic Health brand, kind of rebranded. We left insurance and we just focused in on how do we serve people in a better way as a primary care lens, but doing a lot of deeper engagement in terms of their health, deeper lab work, genetics, advanced testing of different kinds, long visits. And the goal here is really just to try to improve health, restore health, prevent disease.
So so this change happened in 2024, I believe you said, and so you've been operating like this for 2 years, not on the insurance model. What's the biggest surprise that you've had so far in this new way of doing business?
So, I mean, it's hard to leave something whether you like it or not. Right, the enemy you know is a lot better than the enemy you don't know potentially.
Mm-hmm.
So it just, there was a lot of things happening, just wasn't going to jive with us. And so you step out and you just hope for the best. There are some ripples, of course. It's always hard to change from a logistics perspective, from a patient perspective. It's hard. But we've had a very, very good support. So, for example, my patient panel was cut a ton in terms of the number of patients I see, but the patients that followed us, I didn't have to accept a single new patient once we switched over, that we had enough people that supported. They believed in what we were doing. We had been doing it a little bit already, and so they were already bought in. So that was so nice just to see that support. And then it's so rewarding to have people come and say, this is the first time I've had a doctor listen to me. Or I knew something was wrong, and it just took peeling back the onions to figure out the answer. It's that part is what I'm doing this for, and it's why I come to work every single day.
Yeah. I was going to ask you what was your inspiration for getting into medicine, and why the shift? I mean, obviously, the primary care model as it exists today doesn't function for creating wellness in the body. That's clear. I think we all kind of get that. But what was your inspiration for being in getting into medicine in the first place? And then, of course, the second part is what really drove you to want to see wellness in your patients through this new model.
First generation physicians. There's no one in my family that was a doctor, even worked in the medical field. I found the body wickedly fascinating. It's just a interesting. Everything is interesting, and that was a problem in med school because everything's interesting, and you're supposed to find your lane and go through it. But I love learning about everything that deals with the body, whether it's illness or wellness, and that's how I landed in family medicine. I didn't have to pigeonhole myself. I could just do whatever I wanted to do. But I also like a body functioning well. I want that for myself. I want that for my family. And so I want that for my patients also. And so, my wife's a dietitian. And so I already had this sort of like nutrition lens or bent there. And that got me talking with physicians that also were interested in nutrition and what they were doing. And honestly, Asheville is an eye opener. You go and tell someone you should take this medication, and they are like, "No, I'm gonna go, I'm gonna go do this like sound retreat." Like, okay, great, and then they come back and they're better, and you're like, "Well, okay, there's probably something more to health than just prescribing meds," and that's really what opened my eyes.
Yeah, that's what I love about Asheville. That's why I do what I do as well, because I've seen such a vibrant healing community here in so many different ways, and there's an acceptance of all modalities here. And I don't feel like and anybody who lives in Asheville knows that you often can't just be good at one thing. You've got to be good at 2, 3, 4 things in Asheville, and that's actually one of our strengths. So it's a pretty cool thing. So I have a question around what it is, how you define the difference between precision medicine and functional medicine and even integrative medicine. There's a lot of terms, and you'll go by if you're driving down the street and you see a sign up on a building and it'll say integrative medicine. You think, okay, well, that sounds great. And then you'll see something else saying functional medicine. You don't know. So for an average listener, what do you guys practice, and how do you define those different kinds of styles of medicine?
So from a high level, you can go and do fellowship training in integrative medicine and functional medicine and have a certification that allows you to say that you're a functional medicine doctor, integrative doctor. In my head, the way I think of this is an integrative physician tends to use a bunch of different modalities, herbs, nutrients, different healing practices, and they're open to those things, whether they use them personally or not. They will have references or resources for that. A functional medicine tends to be more on the human system and how it is operating as a whole unit and how the different organs are interacting with each other. One reason why we don't claim to be either of those two is one, we didn't go through the training for that. And we see that there's a blend to those modalities of using whatever we have at our disposal, recognizing the body as a fully functional system where fixing a problem in one area may address another problem in another area. But we're also Western trained, and so we also think of the body through that lens too of when there will be disease, there will be dysfunction. Medications is just a tool in the toolbox, and we feel comfortable with that. We're also well trained in lab evaluation. And so that's where this precision medicine comes in, is that we know how the system works and how to get in-depth comprehensive lab work, imaging if we need it, and we can really understand where are the choke points in a system and how do we intervene on that system to improve it. Instead of just saying, I think your gut is messed up, our thought is, well, let's just do some gut testing and really get to the details of what it is that may be going wrong. And then the hope is that as we're working on those things, we're seeing results, not just in the gut, but in other areas of health. So that's kind of that precision medicine idea.
Interesting. And then you do something called metabolomics, which is kind of a new term for me as well. And so you do lots of lab testing yourself. I think of that as when I think about someone doing lots of lab testing trying to get to the root cause of a problem, my head goes to functional medicine. That's all I know. But what is metabolomics? What is your kind of lab analytics that you use for your patients?
Yeah, so we'll do the traditional labs that a functional medicine doctor would run, because those are very helpful, and those are what we've been using for decades. They have lots of data behind them. As technology has gotten better, we are able to look at these omics. So the first one that came out was genomics, so able to understand how your genes are influencing the decisions you make in terms of health and how health outcomes. There's proteomics, and then we have metabolomics. Metabolomics is the second one. They haven't figured out proteomics yet. But metabolomics is the idea of understanding how a system is working. So as an example, how your metabolism in the mitochondria is working from step one all the way to the final product. And the point of it is that it's a whole bunch of data, but you're trying to understand where are there bottlenecks in the system that you could intervene on that may not be picking up as a elevated blood sugar, as an example. It's picking up way earlier than that, more subtle variations that it's trying to predict outcomes in the future and doing things that keep you from getting to that point.
That's interesting, because I think we talked about this in our initial call. I forget who exactly it was. I think it was you, but I mentioned that there was a bacteria, and I think maybe you said the name of it, that was like an FDA-approved probiotic that was able to lower blood sugar and improve for lowering blood sugar. At least there was a clinical trial that showed that it could do that. I forget which one it was, but for someone dealing with blood sugar issues, to me, that was like that one step back that you just described. Is that if you don't have a functioning gut microbiome, that could be a part of increased blood sugar, which could be a part of dementia, for instance, right? So like trying to figure out where is the chain broken, and because it's also connected.
Yeah, that bacteria is Akkermansia there, but that's a measurable bacteria. Not everyone has Akkermansia. Some people who have diabetes, they already have Akkermansia, and that is not their issue. But when people who are deficient with Akkermansia and they do show signs of insulin resistance, that there are studies that support supplying them with Akkermansia improves their gut's ability to manage glucose in a different way that helps them regulate blood sugar as a full system.
So on that same line of thinking, what you can test for, deficiencies are something that crop up time and time again. We've got toxicities on the one side of the spectrum, and we've got deficiencies. What kind of deficiencies do you see are common and that you regularly address?
Yeah, and this is a bigger problem than maybe we all even realize. And it's definitely a problem in the wellness industry, mostly because when we think of wellness, we're eating well, we're working out, and then we jump and we say, well, let me take these things or do these things as a way to improve my lifespan or health span or whatever it is. But so often we're missing that we may be just insufficient or deficient in nutrients. And that is really the lifeblood of health and the function of our body. And some of these nutrients can be measured, of course, and we do that all the time. Some of the nutrients are tough to measure, and you have to kind of use alternative ways to understand if there's deficiency or at least insufficiency there. So in 2017, there was a study that came out that showed that 30% of the U.S. adults and children have at least one nutrient deficiency, vitamin or mineral. And that, of course, changes or increases depending on other medical complications that you have. Interestingly, if you took a multivitamin, didn't matter what it was, it went down to less than 15% of people had a deficiency. You're not measuring anything. It's just random people. They just checked their labs, and this is what they found. And we see this too. So we used to do very in-depth micronutrient evaluations where we measure almost every vitamin, mineral, amino acid, fatty acid. And we'd commonly see things. So vitamin D, magnesium, potassium. vitamin A, most of your B vitamins, omega-3s, these are commonly low, either deficient, so like your lab test is red, or insufficient, you're just skirting on that low side of it at any given time. And we have lots of data on deficiencies. So we have lots of data of like if you're low in vitamin C, you could get scurvy, right? We know what happens with those things. It's insufficiency that I feel like we're missing, where we'll measure people and their B12 is normal at 300. Well, the lab range is 250 to 1200. And it's clear that your body is needing more B12 or more B vitamins in general. So insufficiency is probably the issue that we try to address the most in our practice. I feel like it's a step one, a foundational type of understanding of your health that at any given time, any given season, you may be insufficient in nutrients based off of your diet because you got sick, because of a medication you take, an illness you have. And it's trying to understand what are those things that I need or what are the most common insufficiencies and solving that first. And that's what helps the body work well.
Yeah, one of the biggest frustrations I think I have around this is that in a general medicine practice, you go get a test and they'll give you results, and it's binary. You're okay or you're not, right? You're in range or you're not, and there's never any talk about we want you to be the healthiest that you can be, and so we'd really like you to get into an optimal range for these. And I don't know if that's because optimal isn't well defined enough with strong enough evidence that they just can't pull themselves to make recommendations around that. But that's been my biggest pet peeve is that there's never, if somebody's just borderline, just inching toward, let's say, prediabetes, right? You should probably do something about that instead of waiting until the binary switch goes on and now you're in prediabetes range. It's like, let's get that. You're trending too close. Let's get you down. I mean, maybe some doctors do that, but my experience is it's been either okay or not on a thing. So glad to see. Now you've got 3 supplements actually that I've come across in my research, the F1, F2, and F3. Tell us about what those are and how those address some of these insufficiencies.
Stay with us. We'll be right back.
And I want to tell you about something we're putting together this fall. The Taste of Wellness Asheville 2026 event is happening October 24th. Asheville is just named the #1 wellness town in America, and this event is really a celebration of the incredible wellness community that we have right here. You'll get to experience many wellness sessions, inspiring talks, and connect with some of Asheville's best practitioners and wellness businesses all in one afternoon. So if you're curious about wellness and want to actually experience it rather than just hear about it, come join us. Tickets are available now at tasteofwellnessasheville.com.
So, like I said, we did all these measurements on nutrients. And since we firmly believe that solving nutrients is number one in health, we would tell people, go out and you need to replace these nutrients. And the list instantly would become 15 things long. Take this. And no one wants to do that. I don't want to keep up with that as a doctor, what person's taking when their list is that long. And so we noticed this is probably a 2-year time frame, that 80% of them were about the same, that the same nutrient deficiencies popped up again and again and again. And so we partnered with a supplement company that allowed us to personally create nutrients for patients, individual personalized nutrients, and then they would also let us create like kind of bigger batches. And so what we did is we created these products, F1, F2, F3, to try to solve the most common nutrient deficiencies that we see in our practice and what's also been shown in data of most common deficiencies. So F1 is all of your water-soluble nutrients. Those are your vitamin Bs, vitamin C, trace minerals. And then our F2 is the fats. So it's A, D, E, and K omega-3s and CoQ10. And then F3 is essential amino acids. So this one has gotten a little bit of press recently, but the idea is that you can eat, say, 100 grams of protein in a day, and you have good muscle protein synthesis, so you're able to build muscle. But if you add essential amino acids to that, your muscle synthesis goes up. And it's the idea is that essential amino acids deplete throughout the day. And so having a better supply of them allows for protein synthesis or muscle synthesis to happen. But you're using these in a lot of other factors too. So we think it's also one of these essential things.
Well, that's very interesting. I actually was not aware of that. So thanks for
Yeah.
educating me on that topic. I do take glycine regularly just for the studied longevity benefits of that. And there's even some new research that they looked at glycine versus serine, and it was an interesting study. Actually, they showed that glycine plus serine increased in those that had cancer, increased the amount of cancer that they actually had. And they didn't know, was it one or the other? And so they took away the serine, and they found that if you just supplemented with glycine, not only did it improve, but it actually kind of reduced the amount of cancer activity. So that was interesting. These are all preliminary. Anybody who's listening to this, please know that this is all like one study. There's just one study here. Lots of studies need to be done before we really understand how something is working. But so far, glycine seems to be like a great amino acid. So maybe I need to end F3 though to round out my own profile there.
Yeah, especially, I mean, you do a lot of work from a physical activity perspective. So your body's in constant need of repair, I'm assuming. And this just kind of helps aid in that repair mechanism.
Yeah. So let's get to epigenetics. I think that's a really interesting topic, and it's definitely made a lot of headlines recently. I like the quote: "Genes load the gun, but environment pulls the trigger." Maybe some of the listeners have heard of that. Can you explain what that actually means when it comes to epigenetics for folks?
So a lot of us understand genetics from the sense of like sixth grade biology, where it's this code that eventually becomes the blueprint of our body and how our body is working. And a lot of us go from genetics to genetic diseases. So there are conditions that are from genetic mutations that we have in our bodies that can cause a disease. Those are a lot of like newborn illnesses. There are some cancer genetics that make your risk of having cancer 100% or close to it if you have certain genes. Fortunately, all of those are very rare. The other part of it is one we don't really think about very much is that our genetic code, mine and yours, Travis, are 99.9% the same. And yet we are clearly different people. We have different personalities. We look different. And how does that happen? And so part of that, there's many reasons for that, but part of that is this epigenetic idea that we have these tiny changes in our genome that make us unique. Those are called SNPs. And that our bodies are very sophisticated and are able to turn these genes on or off depending on the environment, the signals that we are getting from our surrounding world. And so if we are in getting a lot of signals of good nutrition and good sleep, we feel safe, we feel loved, then we have genetic expression that is propagating genes that would be promoting for that. If we're not getting that, then we have genes that are turned off. Then we have genes that may be turned on that are trying to help us survive in scarce environments or help us to improve systems that allow us to run away or to fight back. And so the environment is kind of what is telling our genes what to turn on and what to turn on based off of need. And the point, like in our practice, we measure genetics. We're using what we see in terms of the changes as a way to say, your body wants you to eat in this way, that it will likely respond better, less fatigue, more energy, yada, yada. And so let's just move in that direction. It's not you have to do this, but if you can move in that direction, you will probably have a better outcome than another person.
Yeah. It seems like the body is an information processing unit almost. Me coming from a software background, when I think about genes turning on and off, I just can't help but think that we're really programming ourselves by our environment. And so if we can look at ourselves as very much malleable and that we can change and have lots of influence over what happens, we're not just a victim to our circumstance. We have a lot of control. And I think there's a lot of hope for people, especially those that are suffering from various diseases, that these diseases can be overcome. So it's a good thing to know that genes can turn on or off. So I'm thankful for the field of epigenetics. Now, you've got a tool that you use called Genomics, and you also have an epigenetically trained health coach I'm aware of on the team. So how does, if somebody's coming in to see you, and they're maybe slightly aware because they've heard this episode and they're like, I've learned about epigenetics. I'm curious how you can help me. How do you take somebody and their information, and how do you work with them with it?
So the genetic test is a cheek swab. It's very simple to do, and it tests, I think it's like 700,000 different SNPs or changes in the genome that have some study correlating to a wellness topic. So any wellness thing you can think of, there are genes related to that. And it organizes it into this really pretty report that's very long. And the way I use it is that when I'm going through the patient's data at the beginning and understanding kind of what they're doing from a health questionnaire, I'm looking at their blood work, I'm using the genetics as a way to tailor how I'm going to make recommendations to them, where I want to push them into, where I want to avoid. And then our health coach, who has had extensive training in understanding these reports, she will use them as more of a coaching side of things, of using it as validation, or this is what your genes show. Let's try to make this tweak today or this week in terms of your exercise to push you more towards endurance, whatever the thing is. And we're constantly going back to it. So each year when people renew, I'm going back to it, looking over again, refreshing, and the report updates. I love that about this company's Gene Metrics is if new studies come out, they're going to plug it in. The algorithm's going to change a little bit. And so I press the update button and I can make sure that what I'm telling people is the most up-to-date information that we have available.
Wow, that's powerful. Like that is super valuable because now you're able to, with one cheek swab, stay up to date forever on updates that are personalized to you. I guess that really is where the precision part of the precision medicine comes in.
Yeah, it's way more detailed than like people have done 23andMe or something like that. 23andMe got dinged by the FDA because they were using medical terminology in their reports as they really truncated it. So if anyone has done that before, you're like, oh, I don't see too much information there. Ours is 120 pages of information, way more than you need to know, but it's helpful for us to understand from a complexity perspective.
I had mine done by a company called Nebula Genomics, and they honestly, it is something that it's best to have these reports. It's best to have professional support, I think, on some of these, because what comes back can use, it needs a little bit of identification of what's important, what's not. In my case, it can be hard to read, I guess is what I'm saying. And it can be hard to know what to do and what are the actionable things that you should do based off of the report. So I do feel like it's nice. It would be nice to have a coach to sort of work through some of those decision points. So that's cool that you have somebody who can do that. All right, well, let's move on to peptides because I'm curious about, and I think that it's a trending topic, and there's a lot of potential for peptides. And the one I'm familiar with is BPC 157. That is the one I believe that could help support injuries, ligaments, tissue regeneration, repair, that kind of thing. How do you use peptides? What can you say about those, and what other ones that are interesting to know about?
So yeah, peptides has become a hot topic. It seems like I'm not on social media, but I hear from patients that they're asking me lots of questions about it. And it is an exciting area of practice or therapeutics They, just to orient the listener, if you're not aware, peptides are short chains of amino acids, and they work as a signaling molecule in the body. So all peptides that are available have a derivative in the body. They've just been remanufactured usually they're injections. There are some that are capsules. But you use them as a way to tell the body or to nudge the body in a direction. So you brought up BPC. If you have an injury to a joint, if you have gut inflammation, BPC has been shown in some animal models, at least, to improve signaling to those areas in order to improve healing. So the body sees BPC floating in the bloodstream, and it's going towards these areas of injury. And then the body reorients blood flow, immune system to try to attack or tackle, improve, heal that area of the body. So it's a very exciting field because they don't really come with very many side effects, and they can be very specific to a need. The negative that everyone needs to caution, I feel like I have to caution, is that they're not FDA approved. They are considered experimental. I hope that changes as they get more popular, that we start to see some at least small trials, and there are a few that use humans. There's a lot of data, so lots of people talking about how well they work, and we clearly see that in our practice. So we recommend you working with someone who's familiar with them. Some people buy them online without any guidance, and just like you said earlier, I think these are something where you need to have some level of guidance, at least from a purity perspective, making sure what you're buying is appropriate. But it is the next wave, I believe, is peptide therapies, using them in practice. So I think they're very exciting.
And I think there's maybe 100 being studied currently, or at least that are available. Which seems like an overwhelming number to even consider. I take collagen peptides. I think those are the most familiar. I think for most listeners, you can find collagen peptides pretty easily. Those are the same, right? That we're talking the same language.
Sort of idea. I would say the most popular one are GLP-1, so semaglutide, tirzepatide.
Right.
Those are technically peptides, and they work so some of these peptides are FDA-approved medications. That's an example. There are some that were pharmaceutical studied molecules that failed the endpoint that they were studying, and so they sort of scrapped them. And then some random person noticed that they had other potential benefits, and that's how they got popular. You're right. There's hundreds of them probably. We probably only use 10 to 15. There's only a subset that has a good bit of signal that we like, that we see pretty consistently. And so we just stick to the ones that we know and are interested in the ones that we don't know yet.
Yeah, and I think I mentioned this earlier when we were talking before, is that a lot of times marketing gets ahead of science, and when we see anything exciting from a subsection of something, like let's say the probiotics is an example, and we see some benefit, then what happens is marketing takes over, and it espouses tons of claims that may or may not be true, and puts together combinations of probiotics and things that are kind of random, in my opinion, because none of these combinations have often real science behind showing that this combination with this amount from this manufacturer will produce this result. So you often don't know what you're getting. Not to say, don't take probiotics, but it is something where I think peptides probably are in that same class of, well, we're just not sure. We think there's lots of great benefits, but it takes probably decades to tease out all of the different mechanisms that are at work and come to some solutions on what we should be doing. I hope AI helps speed that process up, maybe with modeling. That's one promising thing that we have going for us, I guess, there.
And discovery. So being able to even understand peptides that we can't measure, there's probably some bucket of things we've found that we have no clue what it does. And I'm sure AI will be helpful in that. I know it is in the pharmaceutical industry of creating new molecules.
Yeah. Lots of interesting things going on there for sure. Let's get into diet. These are, and the reason I want to go into diet is because I think it is one of the most challenging things for people. It's actually kind of easy to take a supplement if you can remember to do it. You just pop it in your mouth and you're good to go. But being able to eat for health and eat for wellness over the long term is really a struggle. We often, start one diet and move to another. And I myself have done that. I've tried. I was on a fruit diet, an all fruit diet for a while to see how that worked. It worked horribly for me. I was on a raw vegan diet as well. Also extremely challenging, and I couldn't do that either. I'm kind of on a keto diet now, and when I say kind of, I mean I'm not measuring my ketones. I'm not being strict, but I'm aware of how I feel when I eat this way, and I like how I feel. And so I'm sort of gravitating naturally to eating just more fats in my diet, simply because I like it. I have less bloating, digestion, that kind of thing. How do you approach diet? How do you work with folks when there's like so many different variations out there?
Yeah, and I've done the same thing you have. I have not done the fruit diet, but I've tried my own exploration. Like I said, my wife's a dietitian, and so that is part of it. But I would say through the years, I've become more and more diet agnostic, of more just saying whatever diet works for you, works for you. That's number one. You have to be able to stick to it. And if you don't like what I'm asking you to eat, then it's not going to work out. Number two, there are reasons that maybe one diet is, quote, better. That's where we come back to the genetics and epigenetic idea that there might be some that just work better. You may have conditions where less gluten would be a good idea. And so going more ketogenic would be a favorable way of doing that. But I think the way I think of diet is we know the general idea of what's healthy and not healthy from a food perspective. Whole foods, minimally processed, as close to the source as possible. That's what we're trying to shoot for. And I feel like if we're doing that 80% of the time, that we're probably good enough, regardless of the macronutrient percentages that we're hitting in each individual meal. I think food is also helpful from a social perspective, a community perspective. So many people get isolated when they get so restrictive in their diet that they can't go hang out with their friends because they can't eat any food that's at the restaurant that they're at. So that worries me. And unfortunately, I don't think that we can rely on food anymore as the sole way of getting nutrients in our body at a sufficient level, at least all of the time. And that's just the reality of our lives. We're going to be busy. We're going to miss meals. We're going to not have enough time to cook meals. I have two young kids at home. They have their own thoughts on what's good and not good, food-wise. And so we have to also be realistic that diet may not be the be-all, end-all. It's helpful. We should always focus on good, healthy meals as much as possible. But I don't think that would make it so I'm doing that, so therefore I don't need to take something. Therefore, I don't have insufficiencies. I don't think that's true. Whether that's the quality of our food that we're eating or the inherent inflammatory burden that we may be experiencing in a given time due to toxicants or other illnesses, medications that we may be taking. And so it's eat what you love, stay in the framework, the general framework of what's healthy and not healthy. We all know those things. And then the rest of it kind of shakes out.
Yeah, I think I'm sort of gravitating similarly, is that I have a baseline of like, I know what's good for me, what's not. And it really actually, it's starting to become very easy because it's either, for me personally, it's either sugar and carbs oriented or it's not.
Right.
So I don't really have a lot of choices. I look at a food and I say, is it high in sugar and carbs or not? And I know like my decision should be. And I also allow myself some flexibility to even enjoy those things. It's just like, like moderation. I think that 80-20 rule, 80%, I'm good, and 20%. I think I'm 90-10 though. I'm going to pat myself on the back. I'm like 10% bad. Yeah. And it matters, how your body processes all of these things. We know obviously that, some people process alcohol, for instance, better than others. Some folks' liver is better at doing that. And even as we age, we have to change some things. So we know that processing alcohol as we age becomes more challenging. I think all of this is really contextual and it's highly nuanced. Becomes really challenging to talk about, I think, and to make recommendations. I do like to start from a Mediterranean. Just I feel like that's it. That is kind of has earned the gold standard. You start with that as a baseline and can deviate because it does have kind of all the food groups in it. It doesn't exclude really anything, but it does choose healthier options. I guess. What do you think of that? Is the Mediterranean would that be a good starting point, or do you even make such a
Yeah, no, it's tried and true. It has a lot of data behind it. So you can't argue 20, 30 years of studied data on a Mediterranean diet, at least a style of eating, as a beneficial.
Yeah.
And that's probably one to gravitate to. And then you maybe for 6 months or a year, you push into a ketogenic diet or push into something else. Or you just say, I can't tolerate gluten, so I'm going to do this and just avoid gluten-containing foods. And that's a good framework to be in. I agree with you. That's probably a nice starting point, launching point.
And you said you tried keto, right?
No, not down to 20 grams per day. I like to bake bread, so it's probably never going to happen. It's just that's my 10%.
Yeah. Oh man, there's nothing like some like homemade bread. Like there's absolutely nothing like it. Do you do sourdough or what kind of breads do you do?
Yeah, mostly sourdough. That was my outlet in residency back in 2015 or so. So
Nice.
yeah.
Nice. Yeah. Amazing. All right. I guess last topic to cover is muscle loss with age, also known as sarcopenia. I think that is a pretty underappreciated threat to longer term health. And I also don't really see it as something that is being addressed preventatively when people are like in their middle ages. As it feels like very reactionary. Is that once you're diagnosed with like sarcopenia, maybe you've gotten on to into your 70s or so, or and then it becomes a problem, and you start having to try to figure out how to handle it. I guess, what is your recommendation or stance? How do you help people not develop sarcopenia? If how do you prevent that within your model?
So first thing is that we can argue which diet is best all day, but there has never been a study, to my knowledge, that has a negative impact when exercise is the primary intervention. It's always a pro. And it doesn't matter if it's cardio, resistance, high intensity interval training, it's all positive. And so if there's any one thing that someone can do for their health, it's to move more, and especially to move in a way that is challenging to your body. That's really the definition of exercise, is to give your body a stimulus that's outside its normal. We measure body composition in our office on every single patient, and with body composition scans, you get a weight, but it tells you how much of that weight is body fat, lean mass, bone density. And so we're looking at muscle mass and bone density very regularly on people. And it's very rare for me to see out the gate someone with a normal muscle mass, especially with women. So we see a ton of people they're not sarcopenic, but they are bordering that line pretty closely. And I think a lot of that is just, especially women in their 50s, 60s, the messaging of most of their life has been to stay thin and small and not to go lift weights because that's what men do. And I think that is changing. That messaging is changing. That being a physically strong woman is a good thing. There's also other challenges hormonally that plays into that. But I think strength training is a big piece that is missing. That we think of, we're in America, we think of running, biking, jogging, swimming. That's kind of what we gravitate to. But we very rarely think of strength training as a modality of exercise, or it's just for like 18-year-olds. So I think that if anybody can increase muscle mass, even just a little bit, your functional ability in your life in your 70s, 80s, and 90s is demonstrably better. And that's also been shown in studies. 90-year-old women lifting weights, gaining muscle mass, and feeling better, falling less, able to do more things. And so, in my opinion, that's a non-negotiable, is some level of strength training and just really watching and following that over time.
Yeah, and people don't realize, I think, it requires less than you think. Or a better way to say it, anything you do is beneficial when it comes to strength training. There's like maybe an ideal, but doing something, even once per week, if you did a full body workout once per week, that is substantially better than doing nothing. Like if you looked at a lot of the charts on anything you want to measure, whether it's longevity or blood sugar control, uh, risk for sarcopenia, activity matters, and the more the better, up to a point. But for the most part, the idea is get out and do something you love. What I do, I was mentioning this on the last podcast. I go outside and I just enjoy being outside. While I'm out there, I will just do some push-ups. I'll hang on a tree and maybe do a few pull-ups, maybe do a few squats. And right there, I've got a full body workout. Essentially, I've done all of the major moves with squats, push-ups, and pull-ups, or just even hanging if you don't want to do pull-ups. Like that is. And it's easy. It's like I'm outside, I'm in the sun, I'm enjoying myself. So
Yeah. So just a personal story here. I have 2 young kids. They are at the time of this recording 5 and 3, and I didn't step inside of a gym until like I started here at this practice, 2019. And it's a little bit of like you got to walk the walk if you're going to talk the talk. I was a very active person, but lifting weights was never part of my thing I like to do. But it is important, and I saw the data is very clear. So my workouts to this day, 5 years after having kids, is I do 2 30-minute workouts per week in my gym with free weights that I bought on Amazon and a bench that I got off of Facebook Marketplace. You can see the change on our body composition scan from 2019 to today on lean mass by just doing that. And it's the consistency piece more than what I'm lifting, because people lift way more than I do, but I'm pretty regimented at twice a week. And I think that is the big thing for people. That's an hour of my time in a week. It's very simple to do, and it doesn't take a lot.
Super efficient, 30 minutes. I think I could get behind 2 30-minute workouts a week pretty easily, especially when it requires maybe a few pairs of dumbbells. Speaking of habit change, is that the hardest thing that you see it is for most people, is habit change. It's not what to do once somebody's given what to do. It's then actually implementing it and staying consistent. How do you approach that? And I assume that's what your coaching is about.
Yeah, so that is her bread and butter. I obviously will speak to it and encourage and motivate, but what I say in a visit is out the window an hour later when they. So it's the health coach, that accountability aspect of it, that gets people kind of remembering that this is what we talked about, and the check-ins that she'll do has been very helpful. It is tough. We are built as creatures of comfort. We do not like change, especially if that change is taking us into more discomfort, right? For asking people to work out, as an example, that's uncomfortable. I find that if I can get someone to do it, and they give me, I see people 3 months after the first visit. If I can get people to do it for those 3 months and they come back and they feel better, their anchor for what they accept in their life is different. And it's that piece. Then they like, well, I'll never go back to where I was because I feel so much better now. I didn't realize that I could feel better. And that's kind of the thing that propagates itself. But the getting started, that inertia piece, is tough to overcome. And I think that's where a health coach is helpful. Sometimes if they have bad lab work, that's helpful. If I say like, this is technically a place we should put some medications in, and they're like, no. Like, great, I'll give you 3 months, but you got to give me 3 months of effort. And that's all. It's a good motivator.
I like that. Yeah, no, I think that's great. I love that. Having a goalpost and saying, all right, let's do it. Let's, you got 3 months. Let's see what we can do, and sort of like, rooting the person on. I love that. That's really actually pretty smart. It would motivate me, especially if my doctor was like, "All right, you got this. Like, let's go. Let's see what you can do." I'd be like, "All right, I'm really going to go for it." So that's amazing. All right. Well, anything coming up on the radar for you? Any launches? Any programs? Anything you want people to know about that feels interesting?
So we're an active practice in Asheville. We also have licenses in all the neighboring states. So if you are interested in working with us, you can go to our website at authentichealth.com. We did just release a new sort of dip your toe in program where it's a full set of blood work, about an hour and a half, 2 hours with me, body composition scan, and we just go through that data. You don't have to join our practice at all. It's kind of a one-time thing as a way to just get a full assessment. You can go to Function Health and get your labs, but you're going to have someone look at them and tell you what that means. And so the idea is to give you as complete a rundown of your health as possible. I give you what I would do, my thoughts for the year. Like if you do these things, my expectation that these numbers would get better, your health would get better. And that's a summary that you just get and you leave and you go implement it yourself. So that's the newest program we have. Our other programs, it's a year, you join for a year. And so some people didn't need that. And so we thought this would be a good way to start getting that health out. If you don't want to join a practice, I do have a fairly regular YouTube channel where I'll post some video per week, 20, 30 minutes, just about some health topic that I'm seeing in practice that I get asked questions about a lot. And my hope there is that I just can cut through some of the noise in the wellness industry and give people some really thoughtful advice just from my perspective. And if I can help one person, that's a good thing to me.
Yeah, I was just watching the last episode. I think it was March 11th, 2026, on omega-3 fatty acids and homocysteine and the interactions and why. So I encourage you. It's great information. I was really enjoying listening to it, and you're going to learn a lot. So I definitely see that as a great starting point to learn more about what you do. And I believe we've got a special offer for the listeners. I think it is 10% off for the F1, F2, and F3 packages, the vitamins, the minerals that you mentioned earlier. Is that correct?
That's correct. Shop authentichealth.com, and the code is BWELLAVL, all one word. And get you 10% off whether you buy one thing or you sign up for a subscription, doesn't matter. But the hope is that you can try them out and see what you think. And we love them. We're very behind them. Our patients love them. And it just makes it a whole lot simpler to know that you're getting everything that you need in as little of effort as possible.
Awesome. Well, it's been great spending time with you. I do appreciate your time very much, Dr. Jackson. And we will get that out. We'll get that into the show notes and get your message out there. Let's keep making Asheville healthy and beyond, actually, as well.
Yeah. Thank you so much, Travis. That's great.
Yeah, thank you. And you have a great rest of your day. All right, that was Dr. Troy Jackson. And honestly, this conversation is exactly why I started the podcast. That's what I mentioned earlier during the show, is that the idea that you can actually know what your body needs instead of guessing, and that a physician right here in Asheville is doing that work at this level. And it's something I want every person in the community to know about. So you can head over to authentichealth.com to learn more about Dr. Jackson's practice and his new precision health evaluation. For supplements, you can visit shopauthentichealth.com and use code BWELLAVL for 10% off. You can also catch him on YouTube at Authentic Health AVL and the Authentic Health Podcast, wherever you listen. Share this episode with someone who's tired of guessing when it comes to their health. And until next time, be well. Thank you for listening. You can catch the next episode while watching the sunset from the Grove Park Inn, wandering through Pack Square, taking a quiet morning walk through Biltmore Estate. You can check out more Asheville wellness news and events and join our newsletter at bewellasheville.com. And as always, thank you for being the best part of our wellness community. And until next time, be well.